The Ministry of Health is set to embark on countrywide screening of sickle cell after receiving reports that over 25,000 children are born with sickle cell every year, majority dying before the age of 5. To the ministry, this trend can be reversed if all Ugandans are screened before marriage.
Partners to have children, they need to be tested and cancelled because the possibility of having a sickle cell child, if both of you are carriers, is high. Every pregnancy, you have 1 in 4 chances of getting a child with sickle cell disease.
Our program is to have a free screening for everyone, and we hope to move to schools, universities, to communities to start and screen, and also to be able to confirm anyone who, if you just walk in, get tested, we confirm you, such that everyone can know, because we want to complement the efforts of the ministry such that people can be able to get the samples from all over the country, diagnose them and send results back, because what is important is early diagnosis, and then the mothers will know that their children have sickle cell or they have a trait.
In developed countries, sickle cell is curable through a bone marrow transplant, but government is still reluctant to apply the same, citing its cost effectiveness. This venture requires 200 million shillings per patient, and government is instead focusing on managing the disease.
It can be cured by bone marrow transplant, or there are cells called stem cells in the bone marrow which turn into any other cells. And this is the only cure of sickle cell anemia.
To emphasize on prevention, we also want to emphasize on early diagnosis and follow-up of these children. That is more cost-effective. If these children are diagnosed early, they can be well managed and they live a normal life.
Statistics indicate that 13.2% of Ugandans have sickle cell trait, and the ministry calls on researchers to investigate what could be triggering this disease that is inherited.
Oxygen circulation in the environment becomes low, then the sickle. I think that is the point, that the environment in which that child sleeps or stays must be well aerated, so that oxygen is available. Once the oxygen tension...
Routine checkups and medication to manage the disease remain the available alternatives to patients as government distances itself from the costly operation to cure sickle cell. Stella Nabakoza, WBS TV, Kampala.